This presentation on vitamin A and lung cancer was prepared by Tova Borer, Ashu Singh, and Beth Sorbo. Lung cancer is a major medical concern in the United States and worldwide. In 2020, lung cancer occurred in 2.2 million people and resulted in 1.8 million deaths, which shows that most patients eventually die of the disease. The ratio of mortality to incidence being 0.87. Smoking and asbestos exposure significantly increase the risk of developing lung cancer. However, lung cancer can develop without either of these risk factors being present. Vitamin A is a fat-soluble vitamin found as retinoids in many animal products or as carotenoids in fruits and vegetables. Retinoids occur in three forms: retinol, retinal, and retinoic acid. Carotenoids are vitamin A precursors that can be converted to retinol in the body. Vitamin A plays a major role in cell differentiation and gene expression. Vitamin A also acts as an antioxidant, inhibiting oxidation and helping to remove free radicals in the body. Cancer is caused by cells dividing abnormally. In some circumstances, this is activated by an abundance of free radicals. Vitamin A plays a protective role in both of these bodily processes, making it an obvious choice for research for cancer studies. The foundational research was instigated with a 1975 study by Eric Belke, who concluded that the rate of lung cancer among men decreased with increased intake of vitamin A containing foods. His findings gave rise to 8 follow-up prospective studies in the following 15 years. These works concurred that consumption of vitamin A-rich foods reduced lung cancer risk. Weak study protocols, limited availability of dietary information, and small sample size prevented the findings from being considered robust. A study by Attakirala et al. Found that vitamin A serum levels were 25% lower in newly diagnosed cases of lung cancer. These results, though, might be due to reverse causation. Was low vitamin A a precursor to lung cancer, or could the lung tumors have depleted serum vitamin A? A study by Stryker et al. Compared beta-carotene food intake with beta-carotene serum levels in smokers and non-smokers. They found that smoking cigarettes had a metabolic effect on reducing blood levels of beta-carotene. Future prospective studies chose to collect serum before disease development to avoid this confounding. More than 20 case control studies found that preformed vitamin A had no relationship to lung cancer incidence, but carotenoids were consistently shown to be protective. When the ability to index individual keratines became available in 1993, the reanalysis of previous data revealed that alpha-carotene, beta-carotene, and lutein zeaxanthin were significantly associated with reduced risk of lung cancer. This new knowledge allowed greater specificity in dietary intake studies. Both case control and cohort studies found strong inverse relationships between carotenoid intake and lung cancer, suggesting that the association was not due to chance. With confidence, researchers began designing randomized control trials using animal subjects. However, the animal studies did not provide the clear support for beta-carotene that had been hoped for. 3 large-scale human trials of beta-carotene came next. The unexpected findings created a major shift in the direction of vitamin A lung cancer research. First, the ATBC prevention study group was prematurely stopped because the incidence of lung cancer was 18% higher in men receiving the supplements than the control group. Then, in the CARROT study, the intervention group received a combination of beta-carotene and preformed vitamin A, but this trial was also stopped prematurely due to an alarming 28% increase of lung cancer among the treatment group. Total mortality was also significantly elevated. Finally, in a large U.S. randomized trial of U.S. physicians, those who received beta-carotene supplements for 12 years experienced no increase or decrease in lung cancer. These three major studies together oppose the hypothesis that beta-carotene can reduce the risk of lung cancer. The increase in cancer diagnosis among smoking men in the two studies suggests that beta-carotene supplementation is related to carcinogenesis. One possible explanation is that the beta-carotene given as a supplement interfered with the absorption of a dietary carotenoid that is protective of healthy cells and inhibits malignancy. More recent cohort studies using foods have further explored this relationship. Whole food dietary studies in humans and specific carotenoid investigations in animal models are the current modes of vitamin A and lung cancer research. According to the Federal Policy for the Protection of Human Subjects, or the Common Rule, human subject studies that may knowingly cause harm to subjects are prohibited from being approved. More research is needed to better understand the relationship between lung cancer and vitamin A. With the research available at the moment, the American Cancer Society and the U.S. Preventative Services Task Force recommend intake of vitamin A be from whole foods, especially fruits and vegetables. However, it cautions against the use of vitamin A in the form of supplementation, as the current research suggests it may increase the risk of lung cancer, especially in smokers or those who have been exposed to asbestos. Our references follow.